Dear students, we will discuss a topic, rather post-operative status, which is not uncommon. It comes under amputation, different levels of amputation. Let's see what is this. So what is this post-operative status? See that, you can see the ankle here, you can see that wound here, of course. Part of the distal part of the foot has removed. So some sort of amputation it is. What is this? It is a forefoot amputation. Usually done in gangrene of distal foot due to atherosclerosis, TO, diabetes, not very commonly done, mainly for tumor and other conditions. Because in this situation, if you want to do trauma, is common, not these two conditions, because these three conditions, because here perfusion, if there is a perfusion is inadequate, if you do this one, it may not heal well. So mainly it is an indication for trauma and distal neoplasms, malignancies, neoplasm, very specific about malignancies. If it is so, this is useful here. But sometimes if you think that angiogram and other vascular assessment shows very clear perfusion up to the midfoot, then we can always do a forefoot amputation and get the heel back, so that they save the part of the foot. Definitely it is worth. But it is not possible in every patient. Remember, most of the time they land with below knee amputation, because below the knee level perfusion is really inadequate in most of these diabetic atherosclerosis and vascular problems. Some patient will may get it. Otherwise, common indication for this amputation is trauma and malignancy or neoplasm, distal neoplasms. Remember, once in a while we have done such a forefoot amputation in a vascular patient, but we could find a good perfusion across the ankle joint. That's why we could get away with that. There's a good healthy granulation tissue after they left it open, and now we put a graft. It will heal well. It will heal well. This graft will take up well because perfusion is good, and they can have the part of the foot, especially hind foot. They can have midfoot and hind foot. So what is forefoot, midfoot, hind foot? You should know. Forefoot is metatarsophalangeal joint. Forefoot. Middle foot is navicular, cuboid and cuneiform bones, and hind foot is calcaneum and talus. Because most of the students will have confusion. What is forefoot? What is midfoot? What is hind foot? Forefoot, metatarsal phalanges. Midfoot, clavicular bone, three cuneiforms and navicular bone. Hind foot is calcaneum, talus. So the entire thing is called as foot complex. Very complex phenomena it is. You got arches, 4 layers of muscles, ligaments, complex joints, because it has to bear weight, it has to have function, it has to balance also. So many things. It's very, very important foot, because entire body weight is in the foot finally, actually. So types are, different amputation types are: Gillis is proximal to neck of the distal base, transmetatarsal. Tarsometatarsal, this is the Lisfranc joint actually. Disarticulation of the tarsometatarsal joint. So midtarsal is talonavicular and calcaneocuboid joint. Across midtarsal joint. So midtarsal amputation is Chopard's. Tarsometatarsal amputation is Lisfranc's. Transmetatarsal is Gillis. Distal to that, only head is removed. Then it is called as Ray amputation. Ray amputation, Gillis is transmetatarsal amputation. Lisfranc's tarsometatarsal amputation. Midtarsal, Chopard's midtarsal amputation. So the different levels of amputation in the foot. Then come pyrographs. Then comes Symes amputation. Then below knee, Gittey-Stokes, transgenial, above knee, like that. This order you should know. You should have the clear idea about what level, which amputation, because MCQ question may be asked, remember. So these are the complications: infection, hemorrhage, late hematoma, stump pain, infection of stump, flap necrosis, stump neuroma. Pain will have, because this way you cut the nerve, pull the nerve and cut it. So neuroma will not occur, and that if neuroma occurs, repeated pain, shooting pain will be there along the nerve, and ulceration of the stump, phantom limb, because if there is severe pain before amputation, and brain in the representative area is always feel that pain, and even after doing amputation, the brain feel that there is a limb and pain. So patient feels that even the below knee amputation is done, patient says, I got a limb is there, I feel limb is there, I feel pain in the limb. So they feel like sometimes they after sleep they suddenly get up, start walking, thinking that limb is there. Then they will keep on telling that I got pain even though there is no limb. It's a very phantom limbs, reassurance, repeated analgesics, psychological thing, the treatment, all those things, because it takes long time to come out of it. Very, very distressing complication is phantom limb. Ideal way is to prevention of that. So just before surgery, before giving anesthesia, try to control the pain by proper analgesic, maybe IV tramadol, pethidine, or NSAIDs you can give if creatinine is okay. So that before surgery, at least few hours before surgery, patients feel that pain is less. So that prevents the development of the phantom limb. That the prevention is better in such way. If there is severe pain and do amputation, there many patients may develop phantom limbs. So distressing, not uncommon. I have come across many patients in a big, wide number of amputation series. So this is the infection on such a stump. So forefoot, I have told the meaning, midfoot, hindfoot. This is the point which many times get confused. So Lisfranc joint is between midfoot and forefoot. Mid-tarsal joint is between midfoot and hindfoot. So this is the this is the Lisfranc, this is the mid-tarsal. This is the Lisfranc mid-tarsal. This is the pyrogap, this is the cymes. So this is how exactly, this diagram is very, very crucial actually. So answer the MCQ, a 14-year-old boy had a huge malignant swelling in the left shoulder girdle. What is the amputation done? Forequarter, hindquarter, guillotine amputation, ray amputation. So find out the answer and put it in the comments. I'll get back to you about the right answer. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered, every topic as far as CBM syllabus is covered. How to examine the patient, swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in a table format is given, and briefly investigations. Of course, treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and have memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's atlas of tissue approximation, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My DigiNour lectures through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, neet, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.